Quinapril Hcl is a medication used to help lower high blood pressure, which can help prevent strokes, heart attacks, and kidney problems. It is also used to treat heart failure. Quinapril Hcl belongs to a class of drugs known as ACE inhibitors, and it works by relaxing blood vessels so that blood can flow more easily. It is important to take this medication as directed by your doctor, and the recommended daily dosage can vary depending on your specific condition. The optimal timing for taking Quinapril Hcl can also differ, so it's best to follow your doctor's instructions on when to take it. When starting Quinapril, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once or twice a day. Your doctor may advise you to start with a low dose and increase gradually to reduce the risk of side effects. The dosage will depend on your medical condition and response to treatment. Take this medication regularly at the same time each day to get the most benefit from it. Even if you feel well, continue taking it as prescribed. It may take 1 to 2 weeks for high blood pressure treatment and weeks to months for heart failure treatment to see the full benefit of this medication. It's important to note that this medication contains magnesium, which may interfere with the absorption of some other medications. If your condition does not improve or gets worse, be sure to inform your doctor. As your body gets used to Quinapril Hcl, you may experience dizziness, lightheadedness, or tiredness. You may also develop a dry cough, nausea, or vomiting. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Your doctor has prescribed this medication because they believe the benefits to you outweigh the risk of potential side effects. Many people using this medication do not experience serious side effects. Be sure to contact your doctor immediately if you experience any serious side effects, such as muscle weakness, slow or irregular heartbeat, fainting, or signs of kidney problems like a change in the amount of urine. Quinapril Hcl may be used to prevent or treat kidney problems, but it can also rarely cause serious kidney problems or make them worse. Your doctor will monitor your kidney function while you are taking Quinapril Hcl. Notify your doctor right away if you experience any signs of kidney problems. In rare cases, this drug may cause serious liver disease. Seek medical help immediately if you experience symptoms such as nausea or vomiting that won't stop, loss of appetite, stomach or abdominal pain, yellowing of the eyes or skin, or dark urine. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. Remember, if you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you're pregnant, thinking about getting pregnant, or breastfeeding, talk to your doctor before taking Quinapril Hcl. This medication can cause harm to an unborn baby, so it's important to use reliable forms of birth control while taking it. If you become pregnant while on Quinapril Hcl, let your doctor know immediately. Before taking Quinapril, it's important to talk to your doctor or pharmacist if you have any allergies, especially to other ACE inhibitors. This medication may also interact with certain medical conditions, such as high potassium levels, liver disease, or a history of allergic reactions. It's important to avoid alcohol or marijuana while taking Quinapril, as they can increase dizziness. Dehydration from sweating, diarrhea, or vomiting can also be a concern, so be sure to stay hydrated. Older adults may be more sensitive to the side effects of Quinapril, so it's important to discuss any concerns with your doctor. If you are pregnant or breastfeeding, talk to your doctor about the risks and benefits of using Quinapril. Always consult with your doctor before making any changes to your medication routine. It's important to be aware of potential drug interactions with Quinapril Hcl. Some products, like aliskiren, gold injections, and lithium, may interact with Quinapril Hcl and change how it works in your body. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Certain drugs that weaken the immune system or increase the risk of infection, as well as drugs that may increase potassium levels in the blood, can also interact with Quinapril HCl. Additionally, this product contains magnesium, which can interfere with your body's ability to absorb certain drugs if taken around the same time. These drugs include quinolone antibiotics, tetracycline antibiotics, thyroid medications, and drugs for osteoporosis. It's important to ask your doctor or pharmacist how long to wait between doses and when you should take your medications. Some products may have ingredients that could raise your blood pressure or worsen your heart failure. It's important to tell your pharmacist what products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs. It's also important to note that a very serious reaction may occur if you are getting injections for bee/wasp sting allergy, desensitization, and are also taking Quinapril HCl. Make sure all your doctors know which medicines you are using. If you or someone you know has taken too much Quinapril HCl and experiences severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately by calling 911 or a poison control center. In the US, you can call 1-800-222-1222 for the local poison control center, and in Canada, reach out to a provincial poison control center. Symptoms of an overdose may include severe dizziness and fainting. Remember, it's always better to be safe and seek help in case of an overdose. Remember not to share this medication with others. To help Quinapril HCl work better, consider making some lifestyle changes such as exercising, quitting smoking, and following a low cholesterol/low-fat diet. It's important to consult your doctor for more details. While taking this medication, it's essential to have regular lab and medical tests, like checking kidney function and potassium levels. Make sure to keep all medical and lab appointments, and consult your doctor for more details. Keep an eye on your blood pressure and pulse regularly while taking Quinapril HCl. It's a good idea to learn how to check your own blood pressure and pulse at home, and then share the results with your doctor. If you happen to forget to take a dose of Quinapril HCl, take it as soon as you remember. But if it's almost time for your next scheduled dose, just skip the missed one. Never take a double dose to make up for the missed one. Just take your next dose at the regular time. It's important to store Quinapril HCl at room temperature, away from light and moisture. Make sure you keep it in a safe place that's out of reach of children and pets. When it's no longer needed or has expired, be sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush it down the toilet or pour it into a drain unless you're told to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.